Hello, everyone. Thank you for joining us today at Rivera's Elmwood Place. We're looking forward to sharing some exciting news with you relative to our long-term care redevelopment program. As many of you are aware, the license for this home will expire in 2020. Today's announcement allows us to redevelop this home in London, which is fantastic news for our residents, their families, our staff, and the community. It is now my pleasure to introduce Mr. John Fraser, Member of Provincial Parliament for Ottawa South and the Parliamentary Assistant to the Minister of Health and Long-Term Care, who will share the details of the announcement with you.
Thank you very much, and it's really a pleasure to be here in London again. I was here about a month ago over at London Health Sciences, making another announcement, and I called it the Mater Tour because my mom, I was in Hamilton before that, and my mom went to school there, but she also went to school at Western to become a public health nurse some 50 years ago. She's not practicing anymore. So it's good to be back here, and I'd like to start by saying thank you to all the staff and the volunteers. I'm sure you have some as well too, for the care that you provide. But I'd like to say the care that you provide for the people who we care for most. And the work that you do is really very important. And I want you to know that I greatly appreciate it. I know that families greatly appreciate it. I've got family. My wife's parents are in long-term care homes right now, in a long-term care home, and we really depend on you. And we're glad that you're here. So I want to say thank you for that. And I'm really pleased to be here to make this important announcement today. You know, paying respect to our seniors who work so hard to build the strong and healthy province that we all enjoy today is very important. Regardless of your age, every person should enjoy the high quality of life that Ontario has to offer. We do owe a particular debt to our seniors to ensure they have access to the supports they need to enjoy a high quality life for as long as they need. Here in Ontario, we're beginning to see a shift in our population. We're seeing a growing number of Ontarians entering their senior years. I was looking in the mirror the other day and I realized in a couple of years I'll be 60, actually about 18 months, which came as a shock to me. And maybe not to you when you're looking at me, but to me it was a bit of a shock. And so we're all going there. We're all getting older. And we have to take action to ensure that we are ready for these changing needs of the aging population. Just last month, we launched Aging with Confidence, Ontario's action plan for seniors. It's a plan that empowers people to make choices that are right for them when it comes to their care, their independence, and how they access government services. Our plan aims to make Ontario the best place in the world to grow older. It is designed to help seniors access the supports they need to keep up an active lifestyle or to get the support they need to live at home longer. Our plan also recognizes that for some seniors, living at home may not be the best option for them any longer. Whether they are no longer able to live alone or no longer want to, we have an obligation to ensure these services they need are there for them when they need them. Pardon me. That is why our plan includes a commitment to build 5,000 new long-term care home beds over the next 4 years. And it also includes a further plan to develop 30,000 beds over the next decade. We want to ensure that these beds are there for seniors when and where they need them. And that includes right here in London. That is why it gives me great pleasure to announce the government is supporting the redevelopment of the Elmwood Place long-term care home right here in London to include an additional 50 new long-term care beds in that redeveloped home. So congratulations. We all know that when the time comes for someone to move into long-term care, into a long-term care home, they don't want to leave their community. So the investment is going to help local residents improve access to long-term care bed right here in the community when the day comes when they need that. Having access to a bed is only part of addressing the needs of seniors in long-term care homes. Our government is committed to ensuring that they have access to the supports they need once they move in. That is why in our action plan, we will increase the provincial average to 4 hours of direct care per resident per day in long-term care homes so they can receive the highest quality care. Once fully phased in, this will mean an additional 15 million hours of nursing and personal support and therapeutic care for residents living in long-term care homes. We want our seniors to live as comfortable as possible with all the respect and the dignity that they are due. The government is taking the right steps to ensure that seniors will have access to care at every stage of their life. So I was just in Windsor before I came here. I was making an announcement about hospice. Part of my mandate, actually, as a Parliamentary Assistant Minister of Health and Long-Term Care, is I have a mandate for palliative and end-of-life care. So one of the things that we did in last year's budget was I was announcing some capital support for hospice, but we also talked about support, adding additional support for palliative and end-of-life care inside long-term care by providing more resources for training. Long-term care homes deal with the frail elderly, a lot of people who are frail and elderly, and palliative care is the right approach. And so I'm really encouraged by that investment. That's part of our action plan for seniors. So I want to again say congratulations. Thank you to all the staff for the work that you do. It does make a big difference in people's lives. I think you already know that, but it's good for somebody to say that out loud. Thank you very much.
Great. Thank you, John, for joining us here today and making this really important announcement. And as I think you look around the room and see the smiles on the faces of our residents, families, and staff, you can tell it's an important day. And as a leader in long-term care, Revera is committed to redeveloping all of our older long-term care homes. Redevelopment is not only urgently needed, but most importantly, it's the right thing to do. The residents who we care for here at Elmwood Place and in all of our long-term care homes have complex needs, and they deserve to live in homes which are modern and have the best design features available. We want to thank the Ministry of Health and Long-Term Care for being with us here today and partnering with us over the course of the last year and a half to chart a pathway forward. We have always engaged in this process with the intention to listen to input from all our stakeholders. Our goal is to land on local solutions that meet the needs of our local communities, and we think we've accomplished just that here today in London. Throughout this process, we've heard that people want Revera to stay in their communities. That's the most powerful message we can hear. We have been really moved by the passion with which people describe the important role our long-term care homes, and most importantly, the important role that our staff play in their lives. We've really appreciated the support of community leaders, residents and their families, and staff have shown us all through this process. And we are pleased that we now have a pathway forward in London, and we look forward to partnering with the Government of Ontario to find solutions in each of the communities in which we serve. So with that, I will now invite Susan up to the podium to manage questions.
Yeah. You going to manage them?
We can manage them together, but I'm
All
good.
right. John's going to manage the questions.
Yeah, we're all good. So I don't, if anybody has any questions.
Yeah, when's the new place going to be built?
Okay, pardon me?
When is the new one?
When will it be finished? I'll give you the best answer right there.
Yeah, so well, we hope to get a shovel in the ground as quick as possible. And when we do, it'll be about 18 months to develop. So we're working with the Ministry of Health and Long-Term Care to get it moving as fast as possible.
So our commitment is to build 5,000 beds by 21-22. So starting in the beginning of the next fiscal year, 18-19. So that's aggressive. We can achieve that, and we're working very hard towards making sure those processes move fast so the shovel can get in the ground. And when you work with partners who are familiar with construction, the new construction, you have to remember that there will be no more ward rooms. There'll be no more four bedrooms, no more. And that's a really important part of this redevelopment, because I don't know, I'm the only boy in a family. And I know my three sisters had to share a room. That wasn't always easy. I'm not sure it gets any easier in life, right? So that's a really important piece of that. of the redevelopment, and we're aggressively pursuing building those beds.
Could I just ask JP a question?
Sure, that's okay. Sorry.
So, JP, can you just describe to us what's involved in a redevelopment? What that means? Like, is that a whole new facility? Is that renovating the current facility? What does a redevelopment mean?
Yeah, it's a whole new facility. It's a great question, and it's going to be located 10 minutes away from here, which is part of what's so exciting about that. So as John said, it is a solution for in this community. It'll be.
And does this facility continue to exist beyond that? Or?
So it's a great question. It's to be determined, and we don't have details yet to share about that. But I think most importantly, all of our residents, staff, and families will join us at our new home, and I think it's a point that's really well made. You know, the new home will have modern design amenities and features. And so while it will have all the terrific amenities associated with a larger home, lots of therapy, exercise space, lots of community space, which the whole community can use, I think really importantly, it'll feel like a small home. It'll be built in small neighborhoods of pods, which gives it a small home-like feeling, which is really terrific for all our residents, families, and staff.
What's the location?
It's 3550 Morgan Avenue, so quite close to here. Yeah, so it's a 10-minute drive, which is really exciting. We know how important it is to keep local homes locally, and we've achieved that in partnership with the Government of Ontario.
What's the cost of this?
Yeah, we won't share details of that, or I can't share details with that. What I will say is that it is a very significant investment on behalf of Riviera in partnership with the Ministry of Health and Long-Term Care. John?
It's in the tens of millions. The way that we come to an agreement with development the developer of a long-term care home of a 25-year payment. So we pay over 25 years. It's like paying a mortgage. So one of the things is you have to go out and tender those things. So you can look around the province and see it's in the tens of millions of dollars. You don't want to be announcing the price so somebody will go above that price, or it's part of a bidding process as well too. So.
John, I know there's a provincial election coming. Someone from the outside looking in sees an announcement like this.
Yeah.
I mean, what do you say to those people who say, well, this is an election announcement?
Well, first thing is that A, we know we need this capacity, and B, we're redeveloping long-term care homes. And one of the challenges was that a home like this, it didn't make sense just to do 78 beds. They needed some new beds, because you need capacity, and you have to build in pods. You build to the current standard. Now, I mean, if you're talking about an election issue, there's a document out by the other party, Mr. Brown's party, that says they're going to build 15,000 long-term care beds in the next 5 years, compared to our 5. They budgeted $77 million to do that. To do the 5,000 beds, apart from the enhancements that I talked about, it cost $380 million. So I don't know how you can do 3 times as much for 5 times less. So the numbers are solid around this. We know that we have to do it. We've been working towards doing it. It has to be sustainable. You know, but if you want to talk about electioneering, it can't be done. Those numbers don't work. So, you know, this is what's needed here. It's needed here to support the community. It's needed here to support the residents. I don't know if you have ward rooms here. You do? Okay. We need to change those things. We've known that, and we've facilitated the redevelopment by announcing these new beds, and that's a really important thing. That's why I'm here today. It's not about politics. It's about telling a community you're going to have more of what you need for your parents, for your neighbors, for your friends. That's why I'm here today.
JP, if there's 40 additional beds in the new facility, what's the total beds? Like, how many total beds will the facility
128.
128.
Yeah. So it's a fairly major expansion. It's not quite doubling, but it's maybe about 40% and around that range.
And this announcement just has to do with Elmwood, right?
Yeah, it's just Elmwood.
No other nursing homes in the London area will get extra hours of nursing and.
Well, those are two separate things. So our plan to increase the provincial average to 4 hours will happen in every home, and that'll be phased in over a period of time. There may be other redevelopments or other new builds that occur here. I don't know them. I'm just here to talk today about Elmwood, and so all that transformation. There's more money for, like I said, palliative care training. That's trying to get that into every home, because we know that we need it, and we know actually that there's some excellent care happening in places, and we need to spread that out. There's behavioral supports, which we expanded that envelope as well too. So there's other things there are a lot of things that are happening in long-term care that are leading to better care for people. We also know that acuity, the rates of dementia are rising, and so that's a problem. And the staff here all know how do you address that. So my mother-in-law has dementia, and so there are challenges in her care. And you know that you need things like pain management, understanding what the triggers are. That's part of the training that we do. So I'm going off on a bit of a tangent here, but that's important stuff.
We need more staff.
You're exactly right. Who said that? I can't. Right there. Okay. Yeah. I'll come by and see you after. That's why we're getting to a provincial average of 4 hours. Oh.
How close is it to bus transit for us that don't drive and have to be accessible and on time to work?
There we go.
Yeah, that is a great question. The question was, how close is it and accessible? It is very accessible by public transportation. It was one of actually the main criteria that we used when finding a suitable location. So it's terrific news. It's in really close proximity to Elmwood Place, a 10-minute drive, and it is right in proximity to public transit. So it's excellent news.
It's yeah. So yeah. Actually, it's interesting. I have a home in my riding that when they did the redevelopment, a big redevelopment, the city decided to move the bus stop from not in front of the home to another place, and it wasn't right for people visiting. It wasn't right for the staff. It is really important. So I don't know how many people work here, but that's how people get to work. So that was a really good question, and
I have a question. Is it like extend the beds for convalescent-like unit?
I'd have to. Well, I don't know what the arrangement is here for convalescents, but in my riding of Ottawa South, there's some stuff that's going on in long-term care right now. We're in Ottawa South. We're doing what they call the ACE units. So it's what they call subacute. So it's more restoration to find what the best place to place somebody is. So it's instead of people being stuck in a hospital bed, where sometimes your mobility can decrease, the physio team, in 3 days. You go in walking, and 3 days later you're not walking. You're not ambulatory. So it's trying to move people out, because we know in long-term care, the business of restoration and getting people's quality of life, keeping people moving. So, trying to get people to the most appropriate care. Hospital's not always the most appropriate place, right? Because they don't know the kind of care that you provide. They provide acute care. So, good question. Thank you very much. There we go.